Hello, this is Dr. David Green, CEO of the Georgia Pain Network. Today's topic is the top 10 ways to avoid the need for a joint replacement. Over 1 million joint replacements are performed every year in the U.S., with hospital stays entailing 2 to 4 days. For knees, the average age is 70 years, 60% are women. The infection rate is 1 to 2%. There's a slight risk of blood clots. There's a 90% satisfaction rate with knee replacement, and 85% of them are still working after 20 years. But they are not like God gave you, okay, with your native anatomy. It doesn't reproduce exactly what you were able to do before. Joint replacement is a quality of life procedure. You don't have to have one. It's advisable to wait as long as possible to undergo a joint replacement. They're not meant to last forever. The implants are made of titanium, cobalt chrome, stainless steel, ceramic, polyethylene, which is a dense plastic. Treatment option number 1, activity avoidance. If it hurts, either don't do it or do it less. And that may mean if you're an avid jogger and it's killing your knees, just cut back on it or switch over to cross-training like swimming or cycling. Option number 2 would be over-the-counter medications, including anti-inflammatories like ibuprofen or naproxen, Tylenol, or medications called chondroceuticals or nutraceuticals, and that's glucosamine and chondroitin. They're available at any health food store. Prescription medications include topical prescription pain creams, high-dose anti-inflammatories, Celebrex is an excellent one, and then short-term opiates. TENS units look like what you see to the right. They're battery powered. They're about the size of an iPod. They provide low-dose electrical stimulation through these foam pads, which are placed over the arthritic area. They can change the way the brain perceives pain signals, so they're a really convenient, low-risk option for pain relief. Treatment option number 5 would be weight loss. Less joint stress means less potential damage to weight-bearing joints. Losing weight along with exercise can strengthen up the muscles around the arthritic joint, lessening pain. There's a lot of studies showing how much weight loss can relieve the pain from arthritic joints. Physical therapy can strengthen muscles around the joints, just like I mentioned before, which can take pressure off the joint. Modalities may also include ultrasound, electrical stimulation. Stretching is a crucial element of a physical therapy program. Several studies have looked at acupuncture for arthritis. Pretty much all of them show excellent benefit that is statistically significant, so it's something to consider for pain relief. Steroid injections. It's never been proven that steroids damage joint cartilage. That was only seen in small animals. It was never seen in large animals or humans. They remain a gold standard for arthritis treatment. They're typically given every 3 months as necessary. Remember, they don't alter the disease at all. They're a proverbial Band-Aid, but they can be a really, really good Band-Aid. Treatment option number 9 would be hyaluronic acid injections. These are made from rooster combs. They go under trade names such as Synvisc, Hyalgan, and Orthovisc. They were FDA approved back in the late 90s. Our joints have hyaluronic acid anyway, right? So if you put in more of that, then the hope was that it would provide benefit. And in fact, a large study where the FDA approved it showed that 65 to 80% of patients had good to excellent pain relief for 6 to 12 months. So there's also a theory that it promotes joints to form more cartilage. That hasn't been proven. The 10th treatment option is regenerative medicine injections. This may include platelet-rich plasma therapy or stem cell injections from bone marrow, fat, or the latest is amniotic-derived. Small studies show that these therapies work great. They're not covered by insurance, so keep that in mind. But they can help delay or avoid the need for a joint replacement, and they have very, very, very low risk. What are the outcomes? Most patients are able to delay or avoid the need for a joint replacement. There's always a chance of complications with that surgery, and it is a quality of life procedure. Of note, with the knee injections overall, over 75% good to excellent results. The top non-operative pain management in Georgia is through the Georgia Pain Network. There are several clinics throughout the state, over 10 in fact, accepting over 50 insurances and providing over 25 treatment options with the board-certified doctors. Visit us online today at georgiapainnetwork.com and then call for more information and scheduling at 404-850-9099. I'm Dr. David Green with the Georgia Pain Network. Your pain stops here.